So patients will often ask me, what's the surgical approach to breast augmentation, or basically what incisions are used. And over the years, a number of incisions have been developed to accomplish the goal of placing breast implants. Patients ask me which approach is better, or which approach do I prefer, things like this. This is a discussion between the doctor and the patient. And through an extensive discussion and consultation and understanding the patient's goals and their desires and their fears and their concerns and the things they may have seen or their friends have done, we come up with a plan that suits their needs and suits what they want. For my practice and for my patients, I'm most comfortable with either a periareolar or around the nipple incision or an under the breast incision. Those two incisions heal very well, and they allow us to accomplish the goal with great precision and place the implants exactly where we feel that they're most appropriate. For my purposes, I like the periareolar incision. It served me well over the years and allows me to get the best approach and the best look at everything that we need to do. But if a patient really would prefer to have the submammary incision, I'm certainly willing to do that. So when we talk to patients about the procedure itself, they'll ask me, how long is recovery? What kind of discomfort can I expect? What kind of activity can I do? I tell people to give themselves at least about a week of recovery. And by that I mean they're going to feel sore, they're going to be swollen, they're going to be limited in their activities, but they're certainly not bedridden. A lot of patients are able to get up and move around, get around their house, do some of their normal activities. But it's amazing to me that it takes just about 7 days before people sort of turn the corner and start to feel like they're starting to approach themselves and feel back to their normal condition. From that point forward, for about another 4 to 6 weeks, people enjoy some resolution in the swelling. They don't feel quite as tight. Their muscles are relaxing, and they can find themselves feeling a little more comfortable. The final result really is anywhere between 4 and 6 months, when the implants settle, the rest of the swelling kind of goes away, and they're back to their normal activities. And at that point is the end point. I always tell patients that surgery is a process, not an event. So the day after the operation is not your final result. We take great care to try to walk patients through all of the post-operative steps. We've had patients that are ecstatic about the results that they get from the breast augmentation procedure. It's a great operation for people that are good candidates for it. It gives them a feeling of balance. It gives them a feeling of wholeness. It allows them to wear clothing that fits properly. They can buy tops that fit bottoms. It really is life-changing for the right candidate, and it's really a procedure that enjoys a very high patient satisfaction rate and a very low complication rate as well.